Hi, I'm Ashley Callan, and the policy that I chose today is the Anti-Opiate Bill, also known as H.R.6, or SUPPORT, which stands for Substance Use Disorder Prevention, that promotes opiate recovery and treatment to patients and communities. So, this new opiate bill is to counter opiate abuse and opiate related deaths. About last year, President Trump declared opiate abuse and opiate overdoses as a national emergency. The passing of this bill so far has been very successful. It's over 600 pages, and I believe most of the support or the success of this bill is due to the fact that it is a bipartisan bill. Republicans and Democrats have been working together to ensure that several laws have passed to provide better access to everyone who's afflicted by opiate abuse. So, some of those changes in this particular story are to expand access to substance abuse treatment within Medicaid or provided by Medicaid or reimbursed by Medicaid. Another was also to ensure that the government health insurance program for the poor and disabled also provided those same expansions. However, despite the many sessions that were included in this particular bill package, some experts in the field of addiction, some groups of advocates, and Democrats believe that this particular bill still lacks true, meaningful action. There are several other more important sections of this support bill or anti-opiate bill that weren't discussed in this article. However, I will list them now. Sections 80, 81 through Sections 80, 83, the Support and Building the Capacity for Family-Focused Residential Treatment Act, which would help child welfare agencies, treatment centers, or nonprofit organizations establish evidence-based, family-focused residential treatment programs in order to prevent children from being placed in foster care while their parents are in rehabilitation centers due to opiate abuse. Sections 80, 81 through 80, 83 essentially means that instead of a child being taken away from their mother or from their father or their caregivers in general would cease. So instead, they would have family-centered organizations or family-centered facilities that would allow for childcare, parenting classes, and recovery from opiate abuse. Sessions 1009 and 2001 explains the expansion of telehealth services, which expands access to substance use disorder treatment and other services through telehealth. This particular section is important, very important, for those who are in rural areas who may not have access or transportation to a therapist or a service provider for opiates or substance abuse. Telehealth services also under this bill has been expanded into school-based services or centers to address issues or opiate abuse among young kids, young children, high school and college ages. Sections 8041 addressing economic and workforce impacts of opiate crisis, which authorizes the Department of Labor to award dislocated workers with grants to support local workforce boards as they tackle substance abuse disorder and mental health treatment workforce shortages. The grants are used to provide coordinated job training and treatment services to individuals in affected communities with opiate abuse. The third strength that I noticed within this bill is Section 8122. It speaks on the criminal penalties associated with receiving a kickback or paying a kickback for referring a patient to recovery homes or clinical treatment facilities. I personally believe that Section 8122 addresses any preferential selection that may have been occurring previously or client dumping as well. So this is a very important section. I'm happy that they put that in there. Though I do believe that this anti-opiate bill, also known as support, is a very good bill. I mean, it has a lot of great programs and research opportunities that have been presented or proposed for the future. However, there are some things that I disagree with. And one of those things is Section 1016. Section 1016, called Bettering Data Sharing to Combat Opiate Crisis, allows state agencies access to one or more prescription drug monitoring program databases. My recommendation for this one weakness that I have found personally in this bill would be to ensure that the files that are accessed by any state agency has reinforced security protocols and methods to provide clients and the agency with an added protection of their privacy and rights. As social workers, I believe it's very important that we support these changes by actively informing our employers, our clients, our agencies, and other social workers and professionals. Today, I feel like we have really drifted away from staying informed, not only on things that are of interest to us or our specialty, but on policies and laws that directly affect our clients and other vulnerable communities. Though this bill does cover issues that have historically devastated many lives, such as the separation of families or children away from their mothers or their fathers afflicted with the addiction, support for the workforce economically in times of shortages, the penalization on pay referrals, which could later on lead to client dumping or preferential selection. However, there are some blind sides that weren't addressed in this bill, like ensuring privacy protections, and some select wording would insinuate that there are some biases being thrown among. In these portions of the bill, it basically is saying that opiate users, who are primarily white users, would benefit from Medicaid reimbursements more than someone who may be an heroin user or a marijuana user, which is also very controversial because this was also an issue that affected minorities in the early 90s. So these are my concerns about this particular policy. However, I do agree with it. I think there are a lot of important things that were placed in there that could help us and benefit us. However, I do see that there are some racial biases that, you know, were placed for this particular bill that wasn't placed with other bills. So as social workers, I think it's important that we highlight that we let people know that there are racial biases that they may not see, that may be intentional, but they are in this bill. That's all for me. I really appreciate you guys for sticking in there with me for the entire time. And I hope I gave you some new information